Hello everyone. Allergy is a disease or a condition that can affect any age, starting from a small child till an elderly person. So this allergy is there in many forms. Allergy in the nose is called as allergic rhinitis, where a person can have sneezing, running nose, itching of the nose, eye itching, and this problem, when it's there for a long duration, may turn into something called as sinusitis, where a person may experience headaches, head heaviness, irritation in the throat, where a person need to constantly do this this thing. They need to constantly clear their throat, and this same allergy, when it affects the lungs, is named as asthma or sometimes called as bronchitis. So this allergy is there in different age groups at different types, at different point of their lifetime. This is called as allergic march. So allergy will not stay in the same place at all the time. That is what I'm trying to tell you. Allergy, initially a person in his teenage would have had running nose, sneezing, and the same person after probably his 20s or something may have some tightness in the chest, breathing difficulty, cough. Later on may experience some itching over the skin. So different forms of allergy may come at different point of times in the same person's life, is called as allergic march. So allergy will not stay at a single place, it keeps moving. So this allergy, when it's there in the eyes, is called as allergic conjunctivitis, and if it's there in the skin, it's called as eczema or atopic dermatitis. This allergy of lungs is called as asthma. This allergy, if it is there for food items, it may be called as food allergy. So you may be experiencing one of these or many of these types of allergies. So this allergy, the inception is usually from the age of less than 1 year. A child or an infant may have some kind of rashes on his body, especially on the face, the scalp, the extensor aspect of their body, as these areas, and also the legs. Eventually, this particular skin allergy may shift into these areas, these particular areas, and also behind the legs. Slowly, this may turn into food allergy, where a child may develop some allergy to milk or eggs or different type of food items, including tree nuts or peanuts. Tree nuts such as almonds or cashews, and peanuts that you know. So this food allergy, it may stay for a few years, and children usually slowly outgrow it. However, some severe forms may persist for a long duration. This same allergy eventually may turn into something called as allergic rhinitis that we recently talked about, and may lead to asthma in future. A person may or may not go through all these stages in his lifetime, but some people go through all these stages typically. So these are highly allergic patients. So now that we have discussed about allergic march, now let me tell you something called as atopy. Atopy is nothing but a genetic tendency to develop allergies. Suppose if your father or mother or somebody in your lineage had some kind of allergy, you may inherit that. So allergies are genetic. There are multiple genes that encode this problem. So this nature of developing allergy that is called as atopy. Allergy itself is a reaction, a normal reaction to a substance that a normal person wouldn't react to. That's allergy. And this is guided like the background. Atopy is the background for this. Now let's discuss about triggers of this particular allergies. Trigger can be anything. It can be an indoor allergen or an outdoor allergen. Allergen can be inhalational allergen or a food allergen or a contact allergen. So allergen, as in, suppose the common things that you know are dust mites, cockroaches, and mold. That is fungus that usually grows in the walls that are quite damp and wet because of some leakages. So these are indoor allergens, and they are very, very powerful and cause they have the tendency to cause something called as asthma. So these particular allergens are there in indoors. Not everybody gets sensitized, but people who get sensitized develop symptoms. Outdoor allergens are pollen grains, or it can be different types of allergens that have protein. And apart from these, I told you about food allergens. Something, if you consume something and if you're reacting to it in the form of rashes, hives, or you may have swelling of your lips, so that is food allergy. It is different from food intolerance or lactose intolerance. So these are different terms that we're going to discuss in our future videos in detail. But as of now, I would like to just brief you about these problems. Apart from these, the allergen can be something that can land on the skin and can go inside and lead to allergies. That is contact dermatitis is what we call it, allergic contact dermatitis. So allergies can be in different forms, and these different allergies can have different triggers is what I want to make it clear. Allergies can affect all age groups, right from a small infant to an old person. So this allergy depends, the severity and the area of allergy depends according to the age. Children commonly have food allergies and also skin allergies. Teenagers and adults usually have running nose, sneezing, there is nasal allergies. And adults and elderly people usually have bronchial allergies, that is asthma. So how do we diagnose these allergies? There are various tests that can diagnose what you are exactly allergic to. There's something called as a skin prick test, where we take a particular allergen and put it on your skin in the form of drops, and then we prick those particular things, which is almost painless, and that gives result within around 20 minutes or so. If at all you develop a wheal and a flare, that is swelling and redness to that particular allergen, that means you are sensitized, that maybe you are allergic to that allergen. It doesn't mean you're definitely allergic, maybe you're allergic. However, we ask you some questions depending on which we decide whether you are allergic to that particular sensitized item or not. So this is a skin prick test that is done with precautions. So consult your allergist to know more about it, and the precautions to be followed before the test, and it is relatively a safe test, so nothing to worry about it. So that is one test that can accurately tell us what you're probably allergic to. However, it is a limited thing because you're only going to test for few items. So we're not going to test for everything that is available in the world. So only few common things that are common to this particular area is what we test. Apart from that, we do have blood investigations which can tell us a different type of allergies. This usually is performed in patients who do not suit or who are not ideal candidate for the skin prick test. We choose this blood test for those patients. Skin test is ideally the best when compared to all the blood tests usually, but in scenarios where skin test can't be done, then we are only left with option of blood test, which is also relatively good and gives accurate results. Apart from this, diagnosing different type of allergies needs different types of tests, including a range of tests from blood tests or skin tests, breathing tests to diagnose allergy in your lungs, maybe it's bronchitis or maybe it's asthma. So to diagnose skin allergies, we have different type of patch tests. So this will be decided by the doctor, by the allergist or a pulmonologist who is seeing you, and then they will guide you in this particular thing. Treatment of allergy is a tricky thing because allergy may not be there in one place. If you treat allergy in the nose and avoid treatment in the lungs, that will not solve the problem. If you have allergy in the lungs and avoiding treatment in the nose, it will not solve the problem either. So you need to treat it as a whole. Holistic approach is the best way to treat allergies. Treatment not only involves medicines, it also includes patient education that we are doing right now in this video. Apart from patient education, we need to tell the patient what are the triggers and what are the triggers to be avoided, medicines, and also the precautions the patients are supposed to take. There's one more different type of treatment called as immunotherapy. Immunotherapy is something where we identify the particular allergen that you are probably reacting to, we confirm it in the skin prick test, and then we give something called as immunotherapy. Immunotherapy is given over a long duration. It is a long-term commitment to the patient. However, once it's effective, almost the allergies will be gone by 50 to 80%. In rare cases, it can get gone by 100%. So it's a very effective treatment where it is going to treat the root cause. Root cause as in the immune system itself is going to be modulated, as in the way it reacts to the allergens is going to be changed. As in we desensitize your immune system to a particular allergen that your body is sensitive to. That is immunotherapy. So there are different types of treatment options, starting from precautions and going all the way up to immunotherapy. So it depends on your particular stage of the disease, and we as allergists, we decide which is suitable for you and give the best. When you come to precautions that you're supposed to take to prevent allergies or avoid allergies, if you are genetically prone, then probably you may get it at some point of time in your life. However, it depends on what type of food we eat, what type of air we breathe. So it majorly depends on that. If you are someone who is exposed to dust, strong smells like perfumes or air fresheners, or if you're someone who's exposed to cigarette smoke on a daily basis or occasionally, or even doop stick smoke, even different types of samrani smoke, all these can lead to irritation of your airways. That can lead to cough. We call it bronchitis when it is probably a few days to a few weeks old. But if the problem evolves over a few months to years, then we may have to label it as asthma after confirmation by PFTs. So these particular environments nurture this allergy and may increase it. If you're someone who is using some type of creams or something, you may develop something called as eczema, that's skin allergy. And if you are exposed to some food items such as that are very sour, that are very cold, constantly you may develop cold. If you have this allergic background in your genes, you may develop allergic rhinitis. So this etiology, the reason can be anything. It's a wide subject where there are almost 5,000 identified allergens in the world. Dust and pollen grains are one of those. There are so many allergens that we can talk about. It may take a day to list out all the allergens. However, you can see the common allergens in our website and try to stay away from the allergens and take all the precautions. However, we are living in a polluted environment. If you are especially living in urban areas, especially in our country, India has almost 16 of the top 20 most polluted cities in the world. So our country has the highest pollution, you can say, in the world. So pollution can be in multiple forms, especially the vehicular pollution is what we are experiencing in the cities. So all these will trigger your allergies. They are called as irritants. So a trigger doesn't really have to be an allergen like dust mite or a pollen grain. It can also be something like irritant such as a perfume or that is a chemical, or a polluted particles, all that. So pollution also is a major risk factor for allergies. So these particular things are there everywhere. So how do we prevent from exposing to those things? Probably you can wear a mask when you go outside. Not just any mask, but a very good surgical or an N95 mask ideally would help filter almost 90 to 95% of the particles, which in the long run will matter definitely. Because if you are someone who is on the vehicle for a long duration, especially a two-wheeler, you are going to get exposed to a huge amount of pollution in daily life. It's almost equal to smoking 2 cigarettes in a day, especially in Hyderabad if you're exposed to pollution constantly from morning to evening. So that means maybe a 95 mask can help you, and this doing this for many years will save your lungs from diseases such as allergies and also dangerous diseases such as COPD, that is chronic obstructive pulmonary disease, that we will talk about in our future talks. Thank you for listening to this. Please do subscribe to our channel and share this for more awareness. Thank you.